how will you get it? Will you drink it? Will you be jabbed with a needle? If you're going to be jabbed with a needle, where will it be stuck into your body? The answers to these questions actually depends on many factors, including the person's medication, condition, and mental state, and the pharmacology of the drug in question. While there are many issues to consider when giving medication, including a myriad of routes and sites of drug administration, this lesson will only focus on the principal ones, so you're not overwhelmed with too much information all at once. When I say routes, I mean the different general ways we can give a medication, such as orally, rectally, by vein, and so on. When I say sites, I mean the specific locations on the body where we give the medication, usually an injection. There are 4 principal routes of drug administration. They are known by their abbreviations IM, IV, SQ, and PO. IM stands for intramuscular, where intra means within, and muscular obviously refers to a muscle. This means we are injecting a person with a medication, but we are using a syringe and needle to place it directly into the muscle itself. IV is the abbreviation for intravenous. Knowing what intra means already, you can clearly understand that this route of drug administration is injecting the medication into the vein directly. In this instance, we're also using a needle and syringe, or a catheter, to place the drug into a person's venous system. This is the fastest and most direct way a drug can be administered into the body. SQ stands for subcutaneous. Sub means under, like in a submarine, and cutaneous refers to the skin. So we are placing the medication, using a needle and syringe, under the skin, but above the muscle that the skin overlies. The final major and principal route of drug administration is PO, or per os. Per means by, and os means mouth, so PO literally translates to by mouth. Every time you take a pill and swallow it down with some water, you are taking that pill PO. Before I move on, I do want to give you a concrete example of why it's important to know these different routes of drug administration in a more practical setting. Let's say that you are a doctor working in an emergency room. In comes a patient being wheeled into the ER. The patient is unconscious and thus not responding to anything. You know that they need to get a medication that will help revive them as soon as possible. Which route would you use to administer the medication? IM, IV, sub-Q, or ask the patient to take it PO? Remember, I said that IV is the fastest and most direct way to administer medication into the body. And in an emergency setting, this is what you would reach for. You didn't even need to know that medication given IM, sub-Q, and PO are slower in onset than IV, which they are. You also shouldn't have answered PO because your patient is unresponsive. How could they drink the medication while unconscious? Of course, there are many nuances to this decision, but at least you now have a basic understanding of why you must know the different routes of drug administration from a more practical standpoint. Just like there are principal routes of drug administration, there are principal sites of drug administration too. Subcutaneous injection sites include areas that overlay the back of the upper arms, the abdomen, the front of the thighs, parts of the back right below the shoulder blades, and the very top of the buttocks. Primary injection sites using the IM route include areas of the shoulder and various parts of the upper leg. As for injections given via the IV route, the veins of the forearm are very commonly used. If those cannot be used for any reason, veins on the dorsal side of the hands may be used. By dorsal, I mean the back of the hand. You learned about 4 principal routes of drug administration. They are IM, intramuscular, IV, intravenous, SQ, subcutaneous, PO, per os, or by mouth. Of course, we already know PO goes by mouth, but the first 3 also have specific areas of the body where they are most commonly used. Sub-Q injections can be given into the back of the upper arms. IM injections can be given into the shoulder, and IV injections are most commonly given into the veins of the forearm.
Important job duty. If you're a nurse, you must be knowledgeable about the medications being administered. You must also ensure that the right medications are given to the right patients in the right way. In this lesson, you'll learn about some of the general principles of medication administration. When you give medications, you want to keep in mind that the goal is to help your patients improve their health. Talk with your patients and give them information about the medication. It's the patient's right to know the name, purpose, and possible side effects of the drugs they are given. To promote safety, you want to remember to wash your hands before and after handling medications. Also, when you're confused or in doubt, you need to ask questions. It's your responsibility to administer the right medication, so you need to question any order that seems inappropriate. This is where your knowledge of the drugs and the patient's health history becomes important. If you do uncover a problem, or if you make a mistake, you need to report errors to the patient's physician or other authorities so that the damage can be controlled. One of the main principles of safe drug distribution is to practice the rights of medication administration. We can sum the rights of medication administration up by saying that a nurse needs to give the right client the right drug in the right dose at the right time via the right route, and when that's all done, the nurse must provide the right documentation. Let's look at each of these rights a bit closer. Making sure you have the right client might sound trivial, but it's not. It's easy to make errors, especially if you're working in a busy unit where many patients come and go. Errors can be reduced if you check the patient's wristband and match it to a second piece of identification, such as the patient's case number. It can also help to ask the patient his or her name. The right client must be given the right drug. This can be tricky if a generic version of a drug is being used in place of the brand name drug. Some medications have similar spellings, such as Percocet and Percodan. Both contain oxycodone, but Percodan contains aspirin, which a patient might not be able to tolerate. To reduce errors, you must compare the medication label to the medication order form 3 different times. Check that you have the right drug before removing the drug from storage, as you prepare the dose, and before returning the drug to storage. The right dose of a drug is like getting the right amount of an ingredient when you're cooking. If you use the wrong amount of salt in a recipe, you can ruin the dish. Administer the wrong amount of medication, and you can injure a patient. As a patient's condition progresses, the dose of a certain medication may need to be adjusted. If you notice a change in a patient's status or have questions about the proper dose, it's your responsibility to ask for clarification from the prescriber. Some drugs must be administered at different times to be effective, so the right time is another consideration when administering medication. For example, a diabetic may require insulin before a meal. If a medication irritates the stomach, it may be tolerated better when taken with food. Other medication may work best at bedtime. Many medications are taken by mouth, but not all. Drugs can be absorbed through the skin, injected, or enter the body through other ways. Therefore, it's important to deliver the drug via the right route. You should never change the recommended route. If you have a question, or the order form doesn't specify the route of administration, it's your responsibility to ask for clarification. By following these first 5 rights, you can avoid careless errors. But your work is not finished. To fully fulfill your responsibilities when it comes to medication administration, you need to provide the right documentation. Keep records of the care you provided by making a notation on the patient's chart. Write down important information about your client encounter, including the client's name and the medication name. Also, record the dose, time, and route of administration. Let's review. To follow the principles of medication administration, you should talk with your patients, wash your hands, question any order that seems inappropriate, report errors, and practice the rights of medication administration. The rights of medication administration can be summed up by saying that a nurse needs to give the right client the right drug in the right dose at the right time via the right route, and provide the right documentation.
It may seem like a really simple thing to an outsider. It doesn't seem like there's much to it at all, and it seems like anyone can figure out what pill to give and when. Some people may realize there is more to this, however. For example, you may know that the amount of a drug that is to be given is partially based on the person's weight, but that is also a very superficial view of things. It's because there are literally dozens of factors that influence a medication's action and effectiveness on and within the body, and all of these need to be taken into account or a person may suffer serious consequences. This is why doctors exist, and this is precisely why a person with no medical training cannot safely figure out what drug to use and when. We can't possibly cover all of the factors in this lesson because they range from sunlight and barometric pressure to the way a person's psychological status influences a drug within the body. However, we will go over some of these factors so you can gain a good appreciation of their overall importance. Let's get started with factors like age and hydration status, the state of a person's level of fluid in the body, be it too little, too much, or normal. When a drug is given to a neonate, a newborn, their special circumstances have to be taken into account. Compared to an adult, a neonate has an underdeveloped gastrointestinal or digestive system, as well as inadequate renal or kidney function. This means drugs should be chosen with care so they don't compromise the entire body because of these underdeveloped systems. On the complete opposite end, older adults have their own concerns. These may include inappropriate renal function as well as decreased hepatic or liver function. This means that the drugs that are given to them have to either A, minimally affect these organ systems to begin with, or B, be adjusted by dosage so as not to cause undue harm when compared to a healthy young adult. As I recently said, a person's hydration status must also be considered. If a person is edematous, a state characterized by excess fluid in the tissues, the amount of a drug they need to be given is, all else equal, larger than the amount that would need to be given to a person who is not edematous. This is because the drug has to be distributed over a large volume of bodily fluids. On the flip side, a person who is dehydrated will require a smaller dosage of the drug in order to produce the desired drug action when compared to an edematous person or an otherwise completely healthy adult who is not dehydrated. Pregnancy poses its own set of risks, and as a result, there are a whole range of drugs that pregnant women should not be given. This is because they can cross the placenta and enter fetal circulation, and the very sensitive developing baby will be exposed to some nasty chemicals. This can lead to everything from birth defects to a miscarriage. Additionally, the other kinds of drugs a person is taking can greatly influence the way a new drug will affect their body. Some drugs increase the effectiveness of other drugs to potentially dangerous levels. This means one or both of the medications in question need to be reduced. Other drugs either decrease the effectiveness of a medication or negate its effects completely. This is exactly why doctors ask you if you're taking any medication. They need to know this so they can figure out what drugs they can give and which drugs they cannot give for fear of having a bad reaction. Finally, at least for this lesson, the way the drug is given also affects its actions and effectiveness. Some drugs are more effective when given intravenously, that is to say by vein, than if they are given orally. This is because some drugs are inactivated by either stomach acid or digestive enzymes or cannot be absorbed by the gut at all. We only covered 6 distinct factors that influence a drug's action and effectiveness in the body. Remember, there are dozens more. However, you should have a good understanding now of the fact that many factors go into figuring out what medication to give you, when, how much, and in what way. Not only that, but doctors must understand the interplay between a combination of these factors all at once in an unhealthy patient so they know how much of a drug to give as a result. It's not as straightforward as it seems when you're taking that pill at home, is it? The factors we covered include a person's hydration status, the state of a person's level of fluid in the body, be it too little, too much, or normal, as well as their age. For example, a neonate, a newborn, has inadequate renal or kidney function compared to an adult. Older individuals have decreased hepatic or liver function. If a person is edematous, a state characterized by excess fluid in the tissues, or dehydrated, the amount of the drug they need to get may increase or decrease, respectively, compared to a healthy adult. pregnancy, other medications, and the route of administration all influence a medication's action and effectiveness as well.